Group team of recruiters have all had some great moments in their recruiting efforts. They have seen it all and have found great success in some of the most difficult searches around. Here are some of their stories.
So I think as far as my best moment as a recruiter, I always like the really difficult searches, and probably one of the most satisfying was with a client of mine in Baltimore, where we were tasked with rebuilding their pediatric surgery department. And at the time they came in and hired us, I think we were probably the fifth recruiting company in the last 4 years. There wasn't a lot of enthusiasm or belief that we'd actually get it done, and I think a lot of people were probably tired of talking to recruiters at that point. But we were successful in about 6 months. We had a pretty aggressive approach to go out and find what they were looking for, and certainly Baltimore is a pretty competitive market, which I think made it even more difficult. But a lot of the success, I think, was just working with the client and consulting with them to make them competitive with what people were looking for out there. And it was very successful, and I believe the physician's still there and program's running smoothly, and definitely a satisfying search.
Best experience I had with recruiting with Pinnacle Health Group was when I went to Orlando on a Friday and was going to go visit my little niece for the first time. And I arrived in Orlando and I got a call from Jan Cheney from Quincy Medical Group, one of my favorite clients. And she wanted to tell me that we'd have a change in specialty from general orthopedics to orthopedic trauma. And so basically within 2 hours I was going through these leads that I was getting on my iPhone, and I happened to come across an orthopedic trauma candidate. And even before opening the lead, I just got this really good feeling that this might actually be our candidate. So I emailed her because I couldn't get in touch with her, and I left her a message. And then on Monday I came back and she was interested in more information, and it just happened to be that everything that I was offering her was what she was looking for. And we managed to get an interview basically a week later, and within 2 weeks we basically had our candidate. They loved her. She was so excited about the position, and I wish recruiting was like that all the time, but that was the rare occasion where recruiting is really fun, because not only was I happy, but the client was happy, and so was the physician.
My best moment here after 17 years at Pinnacle Health Group has been getting one initial search in Huntington, West Virginia, Marshall University School of Medicine. And over the past 6 years, we have grown that to 30 placements and multiple searches over that span of time. They now are so comfortable with us that they just call us and say, hey, we need this search. Can you please start on this? We've recruited department heads. They built a brand new $30 million cancer center. I placed the medical director for that cancer center. They are also developing neuroscience department and have placed about 8 physicians within that neuroscience department. So after one initial placement, it has grown to that volume over the past 6 years. That would be my best success here at Pinnacle.
My greatest moment as a recruiter was in Missouri on an emergency room mid-level search. My client did an aggressive sourcing campaign, and within 4 months I had presented several qualified candidates and extended 2 offers. This was a wonderful opportunity for myself and my client to see that the power of sourcing, it does yield quality candidates.
My best recruiting experience at Pinnacle was one that happened last year. Last year I placed a pediatric neurologist with a children's hospital. This particular children's hospital had recently developed a pediatric neurology program. Unfortunately, shortly after the program had started, the person who began the program had to relocate due to her husband's job. He was a general surgeon, and they were having to relocate out of state. So this hospital was left with a brand new pediatric neurology program that was growing and thriving, but they had no doctor. So we began the search with an extensive strategic marketing campaign. We used multimedia approaches to advertising. One of the respondents was a gentleman who actually lived in this community in the past and had worked with this facility, at least indirectly. So he was very familiar with the community and the facility. This physician also was just completing his master's in public health degree, so it was at a time in his life when he was ready to make a job change and a new phase in his career. So the timing was perfect. Additionally, from a cultural standpoint, it was a perfect fit as well. Both this facility and the physician were very mission focused, and it was an exciting process to be part of their mission.